listening to The Ron Reagan Show.
Well, health care is making its way slowly through Congress right now, on both the House side and the Senate side, and we're pleased to welcome right now a member of the House Ways and Means Committee, one of three House committees involved in health care. Brian Higgins is a congressman, Democratic congressman from the state of New York. Welcome, Congressman.
Thanks, Ron. Thanks for having me.
So the White House is intimating that it may do health care without Republican votes. It's been passing in some of these committees on straight party line votes. Have we reached that point now where bipartisanship needs to be just sort of, take second place to more pressing concerns?
I don't know. We may be getting to that point, but I think what's most important is that we get something done. I mean, keep in mind, health care reform has been talked about for 60 years in America, starting back in 1948. And the current system is unaffordable, unsustainable, and unacceptable.
Former Republican Senator Bob Dole weighed in on the argument, saying that if there is not a Senate Republican vote for the package, the ultimate health care package, then the American people are going to be very skeptical. Is that really what would make the American people skeptical, or are they focused on that at all? Or they just want a good health care bill?
Look, I think the Republicans have been politicizing this bill before there was even a bill. The fact of the matter is they don't want this president to have a victory. They want to pick up seats in midterm elections. But I think the American people want action. And as I've often said, we don't need a end to health care reform. We need a beginning. And no bill that we pass is going to get us to the destination that we want to be at, but it puts us in the right direction. And the problem that we have in this nation is that we spend $2.5 trillion a year on health care. It's about 18% of our gross domestic product. It's not only about the 46.7 million without, it's the 250 million with. And the current system is unsustainable. It's punishing small businesses. It's throwing individuals into bankruptcy. And we can do much, much better. We have a system right now, a fee-for-service system that encourages utilization that results in over-utilization, which drives up the health care bill. What we need to do, and you hear the rhetoric here in Washington, they talk about a European system or a Canadian system. The fact of the matter is, we have an American system, and it's called the Cleveland Clinic. It's called the Mayo Clinic. These are places that do highest quality health care at low cost. Unfortunately, right now, they're the exception. We have to make them the rule.
Have the Republicans in general been good negotiating partners at all in this? Have they contributed anything positive to any of the legislation moving through?
Well, the bill in draft form has been available for about 1 month, and a lot of individual groups, including nonpartisan groups, have weighed in. They're beginning to endorse it, small business organizations, various unions, the UAW. So I think they've had plenty of time to review it, but you watch the rhetoric in our committee tomorrow. We'll start with, well, we haven't even been able to see the bill yet. Look, this issue has been around a long time. The whole issue of a public option or a not-for-profit option has been out there for a long time. But the Republicans, even before the bill was dropped, they had a pollster, Luntz, do a 28-page memo to the Republican members of Congress saying, call it a massive government takeover of the healthcare system. So I think, this process, within the context of Washington is always going to be highly politicized. But I think the American people want change. And I think this bill, although it's not a perfect solution, it moves us in the right direction. And I think what we have to move the nation toward is more of a Cleveland Clinic, Mayo Clinic, high-quality, low-cost system where doctors are making decisions with patients about what is the best care that is available to them. And there is explicit reference to issues like bundling, which moves us away from a fee-for-service type of system. There is comparative effective research. Look, what works better? What treatments work better for various ailments? And there's accountable care organizations, which basically introduces market-driven solutions to our healthcare problems. In other words, let's penalize waste and inefficiency and poor clinical outcomes, and let's reward the things that do work. I thought competition and choice were conservative principles, and that's what healthcare reform and a public option represent. competition and choice. A public option is just that. It's an option.
Mm-hmm. Yeah, exactly. Well, 72% of the public in recent polls, including 50% of Republicans, as you well know, want a strong public option. Why hasn't there been more enthusiasm in both parties? And mostly, the Republicans are, of course, dragging their heels on this thing. They don't want a public option. But even some Democrats are, reluctant apparently to give the public what we clearly want. Why is that?
Well, I think there's the substance of the issue, and then there's the politics of the issue. And as I mentioned at the outset, I think the other party doesn't want this president to have a victory because they couldn't do it. They don't want anybody else to be able to do it, and they're also concerned about using this as an opportunity, I think, to pick up seats in the midterm elections. But this thing has been tried. There's been several iterations of healthcare reform dating back to 1948, and I think the interesting thing is that the Republicans were calling, when Truman tried to do it, they were calling it socialized medicine then, and they're still calling it socialized medicine 60 years later. But the bottom line is our health care costs are increasing by 8% every year, and it's killing individual businesses. It's big, large, small, and medium size. It's hurting individuals. More people are without health insurance as time moves on because health insurance becomes so much more expensive. So we're paying more than anybody else, and our outcomes, our clinical outcomes, are increasingly deplorable.
We've just got a few seconds left, Congressman, but very quickly, do you think the bill will pass before the August recess?
I do. It's an extraordinary. I mean, look, I'm a guy. I represent Buffalo, New York. It's a relatively poor area, and I have learned a tremendous amount being a member of this committee about healthcare reform and all of the moving parts. It's very, very complicated. I get it. And I think the other side is better at the blocking and tackling politically. But I think in the end, we have to communicate in ways that the American people understand, and that is, look, we want you to have high-quality health care, and we don't want it to break you.
Congressman, I got to let you go, but thank you so much. Congressman Brian Higgins, Democrat from New York, member of the House Ways and Means Committee. Back with a question for you in just a sec. It's the Ron Reagan Show on Air America.